Welcome to Healthline 3. I'm Linea Allen, and I'm joined by doctors Lise Huddleston and Jeff Hebert from Willis-Knight Pierremont OB-GYN Specialists. If you have any questions for the doctors, call the number that you'll see on your screen throughout the show. That's 318-219-4569. We will be taking your questions live and, of course, free of charge. So, docs, thanks for being with us.
You're welcome.
We sure
Thank
appreciate your time today. Okay, so we are talking about OB-GYN, specifically preventative and annual visits for women. So why are those so important?
So I think a lot of people, forget sometimes that as OB-GYNs, we're essentially a primary care field. So, we obviously, yes, we deliver children, and we also, do surgery from a gynecologic standpoint, but also just as an overall health standpoint, we serve as primary cares. And so, each time yearly, yes, you come for your obviously yearly exam, and that may or may not involve a quote unquote pelvic exam, but that also is your overall health. And so that means, discussing bone health. That means discussing preventative screening like colon cancer screening, or, your Pap smear screening, and also, breast cancer screening with mammograms. And so making sure that, you stay up to date with those things, depending on, whatever task force that you may follow or we follow, is very important. And those are things that we can address each year when you come to your annuals, or if anything's changing from a healthcare standpoint. So if any types of symptoms that you may be experiencing, be it, this is a perfect time for you to discuss if you're having any type of menopausal type symptoms that could be addressed, or if there's any type of other symptoms that sometimes women don't want to discuss, but it's a perfect opportunity for them to discuss. So urinary type symptoms that we may be able to address, and so it's just a good time each year that can be addressed, whether it be for your regular screening, but also just for other type of symptoms you may be experiencing.
Okay, for someone who doesn't normally come for an annual or preventative screening, what do those visits look like specifically, and are they different for different ages?
Sure. So we kind of break it down, to your late teenage years, early 20s. We're going to talk a lot about your cycle irregularities, changes in that, vaccinations you need for college, infections, things like that. And then obviously as we get into our late 20s, early 30s, mid 30s, we talk a lot about, the obstetric side of our job. So the exciting side, we can also screen patients if they're having issues with infertility, same thing, cycle irregularities. If you're planning to get pregnant, the important things you need to do before you get pregnant, taking a prenatal vitamin, having the healthy diet, healthy lifestyle before, smoking cessation and tobacco use. Then after, childbearing age, we get into that 40s range where a lot of things are changing. At 40, we start talking about needing screening mammograms annually. We also, a big push in the last several years has actually been hereditary genetic screening. So things like ovarian cancer, breast cancer, that's really come to the forefront of our field. And there's a lot of great tests out there, but there are a lot of tests out there. So we can kind of talk about those certain tests or certain companies that we like to use, why we like to use them. If you have a positive result and you find out that you are a genetic carrier, that's a really big deal. It changes the imaging you'll need and how often you'll need it. And so that's a big deal in that age range. 50, 60, 70, going through menopause, again, you can have a lot of changes with your cycle, but you can also have a lot of systemic symptoms. So the hot flushes, the insomnia, the forgetfulness, all of that patients may not attribute to menopause, but actually they can be for sure. And so that's really important as well.
Okay, a lot to talk about, and we're going to continue to talk, but I understand we have a caller. So Laura, can you hear us, and do you have a question for the doctors?
Yes, I can, and I do have a question. I'll be 73 in November, and I was just wondering if I still need to get Pap smears.
So a lot of that depends kind of on your Pap smear history, essentially. And so depending on, we follow what's called the ASCCP guidelines, essentially, which is a college, essentially, of colposcopists. But essentially, if you've had a 20-year negative history of Pap smears prior to this, and you've had routine Pap smears probably within the last 10 years, then your routine, that screening can likely fall off. However, let's say that you haven't maybe had a Pap smear in the last 10 years or so, and we don't know that history, then at that time we may say, let's go ahead and get another one at this time. If this is negative, then we may be able to, let those fall off. So it really just depends on your particular history, and that's just, again, why it's important to have an annual kind of appointment so that you can discuss kind of what is guidelines that we should follow for your particular age and you individually, just based on what history you've had before.
Laura, does that answer your question?
Yes. Thank you so much.
Thank you for calling.
All right. Bye.
Bye. Okay, so you were mentioning all kinds of different tests as far as ages and what people could have done and screenings that you could have. Is there anything that women should request, like that maybe might not happen at one particular visit, but they think they might have a trouble with something? I guess what I'm asking is, what kind of requests can women make if they're having trouble, but you might not know that it's the doctor unless they ask specifically about it?
Sure. So, I think the biggest thing is going over family history with patients. A lot of patients, are not really aware of needing early cholesterol screening or diabetes screening, things like that. I get a lot of questions about hormones. I get a lot of questions about, I don't feel right, can you check my hormones? And that's kind of a discussion that I have with my patients. So a lot of times, if your cycle is regular, your hormones are working. I feel like I have that conversation a lot. The other thing that we talk about is patients who are having those menopausal symptoms or no longer having a cycle, but they want their hormones checked. We kind of talk a lot about that. I get a lot of requests for hormone checks, and we talk about that. That's not something that I'm against. I'll do it, but we also talk about why I feel like, just going by their symptoms, it may not necessarily be necessary. So that's something to think about too, as well as vitamin D. If we're going to do these bone density studies, one thing that we need to know, especially if we're going to start you on medication, is going to be your calcium and your vitamin D level. And so that's kind of one that patients will ask for as well.
With the calcium and the vitamin D, would there be symptoms that women might have that would show you or tell you that they might have an issue there? Or is that just something that you automatically check for?
Yeah, not necessarily symptoms of vitamin D. You can definitely have symptoms if it's extremely high, but not necessarily if it's low or mid-range.
Okay. All right, so I know from personal experience that screenings have changed. The recommendations for different types of screenings have changed over the years, as far as, mammograms and Pap smears and how often you need to have these things. What have been some of the most recent changes, or have there been? And what are the screening recommendations?
So, one that's not probably recent, but, that obviously changed is obviously, Pap smear, routine Pap smear screening. It's starting now at the age of 21 instead of kind of in a younger age group. So you may have had patients maybe in their 40s or 50s who, said they may have had a history of abnormal Paps, and in reality, likely it might have existed prior to the age of 21. And we've kind of moved away from that. And a lot of that has to do also with HPV co-testing. And with the advent of the Gardasil vaccine and those types of things. And so those guidelines and some of the kind of grayer areas, which fall in between the ages of like 21 to 25 and then 25 and above, and then obviously above 30, those things have kind of changed. And again, that all kind of depends on the individual themselves. But another big push too, like we said over the last few years, is colon cancer screening. We used to kind of initially start screening for, African American females at age 45, and now that's kind of switched to all age groups starting at age 45. And so it's trying to kind of get that out into the public, where it used to, be 50 and above. And so now we've kind of moved at a younger age just because we've seen such a higher incidence of colon cancer. And so talking to patients about that, and whether it be colonoscopies or whether it be Cologuard or other screening modalities, again, which is so important to come in because, not everybody wants to do certain types of screening modalities. And that's okay, as long as you can sit down and have a conversation about what's going to be, good for you, because certain screening, especially for even colon cancer screening, that might involve screening every year versus every 5 or every 10 years. And so it just depends on an individual basis, and also what type of screening modality we're talking about.
And what about mammograms? How many, is it every year or every other year?
It's every year.
It's every year.
Up until a certain age point, you can make the argument, once you hit 70, for every other year. some of my patients don't want to do that. They like getting their mammogram every year, and I think that's fine. But yeah, it's still annual.
And why would that be? I mean, can changes happen that fast?
For mammogram?
Yes, for breast cancer.
So, a lot of changes come again as the age process happens. You can get a lot of changes with your density and the fat content and things like that. So the great thing is once you start, the best thing to do is stay at wherever it is that you've been getting your imaging. That way they have comparison imaging. So every year that you get it, they can compare. If they see something that maybe they didn't see last year, they make note of that, and you may need an ultrasound or a different diagnostic mammogram. So that's the good thing about staying loyal to where you get your imaging.
And as far as Pap smears, when Laura called, our first caller, when she asked about her specific age, but is there an age when they say Pap smears, you don't have to have those anymore? Is there a specific age, or does it just depend, like you said, on how the past history is?
No, there's definitely a specific age, and typically up until, if everything's been great, fine, dandy, all that good stuff, about 65 is where we recommend, or is for where the current guidelines are. But again, it all depends really kind of on that last 20 years or so, last 20 to 10 years, depending on what type of history you've had. So again, let's say you're 67, but you haven't seen anybody in 40 years, well then that might change a little bit. So,
yeah.
And and look, it's not something everybody wants to come do, and I understand that, but it is, that the important thing that I always try to counsel patients on is that we're very fortunate that we have certain screening modalities for certain cancers, and we've seen such a huge reduction in cervical cancer based on Pap smear screening. We've seen an earlier incidence of being able to catch breast cancer earlier because of breast cancer screening. The same with colon cancer screening. Unfortunately, there's certain things like ovarian cancer that we don't have any screening modality for. But again, that's why it's important to come and talk, because let's say you may have an increased genetic predisposition for ovarian cancer. Those are things that we can talk about, and what does that mean for you, and what can we offer you depending on what your age is.
Okay, so it's all about staying healthy.
Yeah.
Yes, ma'am.
Okay, so speaking of staying healthy, we're in the era of COVID right now. So talk to me a little bit about COVID changes. What are the current COVID trends with regard to obstetrics?
So, I think all of us could agree that 2020 for obstetric patients wasn't as, it was still, worrisome. The Delta variant is extremely worrisome for our OB patients, and the reason being is last year, if you got sick with COVID and you were close to term or in your third trimester, we could deliver you, and that helped with your respiratory function. If you have a baby pushing on your diaphragm, but we deliver you, it's a lot easier for you to expand your lungs. With the Delta variant, we're seeing just such an inflammatory reaction that delivery is not necessarily helping that situation as well as it was before. We have a lot of pregnant patients who are getting very ill, not necessarily with the GI side, but more the respiratory issues, which is a big deal. If you're not getting oxygenated, neither is baby. Right. And so we've also seen what we call vertical transmission, where mom can actually pass COVID to the baby. So we have seen a couple of cases of that. And unfortunately, we've seen some fetal deaths from that and maternal deaths.
That's such a horrible, horrible thing, because you're bringing life into the world. You're so excited about the new baby, and then here comes COVID.
Yeah.
So how do you guys feel about vaccines for pregnant women?
I mean, we're big advocates for vaccinating. The American College of Obstetrics and Gynecology, the Reproductive Society, also Society of Maternal Fetal Medicine, all have pushed in favor to vaccinate patients, and that is before you have a baby, in your first, second, third trimester, postpartum, moms who are breastfeeding. It's all a strong, recommendation to get vaccinated. COVID and the COVID-19 is a very, what some, scientists have deemed a very fit virus, and that just means that it is very good, and that's why we see so many variants, and that's why we had such a bad Delta variant, is because it's able to survive in very adverse environments. So if you create an environment where only X amount of people are vaccinated and others are not, you're going to create more variants, and that's just natural what's going to happen. And so getting as many people vaccinated as we can is a way to kind of combat these things. And so, like Dr. Huddleston was saying, acquiring COVID during pregnancy, it can be kind of catastrophic. because yes, in 2020 we had a little bit of better understanding what we can maybe expect in our pregnant patients. I mean, being pregnant, your body's at a decreased immune state. You're obviously at increased risk for worse respiratory illness, but you throw in Delta, and we saw just a catastrophic number of hospitalizations, ICU admissions, patients who were having to be on ECMO, and so if we can avoid having those types of things again, which we are seeing a little bit of a downtrend, but I mean, we're definitely nowhere near, the green zone at this point.
Right.
So, I mean, we definitely push our patients to get vaccinated, or at least come in and have a conversation with us about it and see if it's something, that we can alleviate some of your concerns. I know that, luckily having the FDA approval is definitely helped. But there's obviously some concern out there still, and I understand it. It's just something that we want to be able to have a conversation with our patients about.
Right.
Yeah, and one thing, I think a lot of people, a lot of what I get or the pushback that I get is because, this vaccine is new. But I really want to reiterate that, the mRNA, the science is not new. So this is actually something that has been studied for a long time. And it actually was started to look into cancer treatment. And so, this is not something that anybody takes lightly. And, for example, Pfizer, Pfizer makes a lot of medications that people don't realize. It makes Eliquis, which is a blood thinner. It makes the EpiPen. They manufacture Advil. They manufacture Celebrex. Over 350 medications. And so I think that's so important for people to understand that this technology, this science is not new. It's not something that's new.
Right. It's been around a while.
Yes.
Decades, in fact, is what I'm reading. Okay, I understand we have another caller. Jane, do you have a caller question for the doctors?
Yes, ma'am. I'm calling to see after having a hysterectomy, how long do you have to stay on hormone replacement?
So it depends on your age. A lot of times patients, have their hysterectomy right around that 40 to 50 age range. Studies have shown that hormone replacement is effective and bone protective, cardioprotective for about 10 years. That's how long you get your benefit. And so I tend to stick with the lowest dose for the least amount of time. But again, that's a conversation that I have with my patients. If you can't sleep when you get off your hormones, we talk about doing something else. There's pill forms, there's patches, there's gels. So there's a lot of different forms. So we may switch you from an oral medication to a patch, just so we don't have that blood clot risk. So it's patient dependent, but on average, I tell my patients about 10 years.
Okay. I had mine when I was at the age of, I think, there's 50-something fibroid tumor. And I'm 79. So do I have to still take hormone replacement?
I think it would probably be a good idea to come in to us or your OB-GYN and talk about probably titrating down. I think you're probably at a point where you could get off of them and really not have any side effects.
Okay, I was using the patches, so do I still have to use them at 79?
No, ma'am, you don't. If you want to quit using the patch and see how your symptoms are, I think you would be fine. You've utilized the patch long enough to where you've gotten that benefit.
And what about the Pap smear? Do you still have to have a Pap smear?
So if you're 79 and you've never had abnormal Pap smears, or when your hysterectomy, when you had your hysterectomy and they told you everything was benign, everything looked fine, no ma'am, you do not need Pap smears any longer.
Okay, that's what I wanted to know.
Yes, ma'am.
Thanks for
Thank
calling.
you so much.
Thank you, Jane.
Thank you.
Okay, I want to come back to COVID and talk kind of about how that may have changed the way you guys operate. But first, I have read that you guys, there's a huge renovation going on at Willis-Knight for the new birthing center, the Nest. So can you guys tell me a little bit about that? I think we have some video we can roll to kind of show you the markups. There's you guys visiting the Nest. So tell me about it. What do we have to look forward to there?
Yeah, we're excited. I mean, we've now kind of underwent renovations. I think they're started on the first 5 rooms right now, but essentially we're moving away from a separate labor unit and a separate postpartum unit, to have what we call labor unit, LDPs, where you basically are going to labor there and you'll also deliver there, and you'll spend your postpartum stay there. And so it's all in one, central facility, and it's, we're excited. I think it's going to just create a better experience, not only for hospital personnel, but also patient experiences, their families. And so it's going to be an all nice single inclusive unit that's state of the art. You're going to have the nursery that's right there. There's also going to be a big central nurses station, and just big nice open rooms that you can kind of be free in. I think that most of the time when you look at these places around the country, these are places that patients want to go, and so it just makes it very nice, and it's a good, calm, nice environment for patients that they can, come and welcome their baby in.
Well, and I think from what I've read and what I've seen in the markups, what we just showed, and that's the bathroom right there, and it mentioned in the press release that we got that they've got the big spa robes, and you can see the hair dryer built in there, and
yeah.
I mean, y'all are gonna pamper these moms.
It's gonna
right?
be Hotel Pierremont. We're excited. Yeah, I'm kind of sad that I'm done having babies, because this is such a cool, great thing, and I think our group is super. We've really pushed, rooming in, having the baby stay. We're pushing breastfeeding, and that bonding time is so important for mom and dad. So not having to pack up your stuff and go, 3 floors up. Even though it's only 3 floors, it really makes a big difference to be able to just have all the nursery staff, pediatricians available. The other thing is, when you're in labor, you form such a strong relationship with your labor unit nurse, and so you're going to see friendly faces and familiar faces the whole time, and I think that was really important to patients, so we're excited about it. It's going to be great.
If it looks anything like the markups, the pictures, it's going to be fantastic. Yeah, I'm way past baby age, but it'd be fun just to go stay, I think.
Yeah.
Okay, so let's go back, talk about COVID again. And when you're speaking of, the big rooms and all of this, I know that especially in the beginning, that parents were having to have their babies and they couldn't bring in visitors, or maybe dad couldn't be there all the time. So what is it now? What are the recommendations or the requirements, I guess, now?
Yeah. So now we, every patient has a COVID test when they hit the door. So if you come in labor and you're 6 centimeters, you get a COVID test. If you're scheduled for a C-section or an induction, you're going to get a COVID swab, 7 days before. We are allowing 1 visitor, typically dad. It was 2, and then with Delta, I think we've gone back to 1, but that's also physician dependent. Some physicians are just a little more comfortable with just 1 visitor, and so that has certainly changed. And then obviously, we don't have the big open windows, and you can't go and look and see all the babies anymore or anything like that, so that's definitely changed.
Right. Are there any misconceptions or myths with regard to COVID that you guys want to talk about, or that you've heard?
I mean, I think some of the big ones obviously is, its efficacy and its safety during pregnancy, like we addressed, and it's definitely, been recommended that, you can get the COVID vaccine, first, second, third trimester, and also postpartum moms who are breastfeeding. But I also think there's been a big misconception with, its cause and infertility, the COVID vaccine in particular. And so, as of right now, there's any data to be able to substantiate those types of claims. I know that there's been, some concerns or claims about some of the cycle irregularity once getting the COVID vaccine, and there is a lot of, data, I shouldn't say data, I should say, funds that are being pushed into that right now with the NIH to kind of look at that. And, anytime you get a vaccine, especially with COVID vaccine, your body's going to go through an inflammatory response that kind of generates a response to it. And so for you to have some of that can be understandable. But most of the time what we try to counsel our patients on is that you're talking about a very transient type response. This is not a long-term response at all. But the one thing that I will tell you is that I think there also is a little bit of a misconception that, if I've gotten COVID, I'm immune to it. And that's definitely not the case. And that you can definitely have had COVID once already and then get COVID again and have a substantial respiratory illness with that. And that also, we have a lot of silent carriers who pass on this virus. And so I think just being kind of aware of the current state of things, and also, like I said, just having a conversation with your doctor about what are the risks, what are the benefits, and where are we at kind of in the current pandemic. While certain populations, such maybe as Shreveport, we may have a little bit of a downtrend in some of our hospitalizations. I mean, you could travel to an area that is not like that. And so there's definitely a lot of areas that are having huge upticks in positive cases and hospitalizations. And so I think just being aware and having a conversation with your provider is probably the most important thing.
So going back to preventative and annual visits, is there any reason why women should be scared as far as COVID goes to coming and having those annual or preventative visits?
Absolutely not. We wear masks and wash our hands 100 times a day. We're socially distanced in our office. Majority of our, if not all of our office workers are vaccinated. All the physicians are vaccinated. So no, it's definitely not. Please don't be discouraged. Please come and get that visit.
Okay, and so one more time, we're getting close to the end of our half hour here, so let's talk one more time about why it's so important to have those annual and preventative visits.
Yeah, I think again, it's just important to stay up to date with your regular routine screening. Again, if it's cholesterol screening, bone density screening, colon cancer screening, Pap smear screening, mammogram, for breast cancer screening, but also to address certain concerns you may have, but be it menopausal, hot flashes, night sweats, mood swings, changes in behavior, and then also to discuss any type of concerns you may have. I mean, we deal with a lot with the stress urinary incontinence and those types of things that a lot of women don't really want to talk about, but it is common complaints that can be typically treated with some of the things that we may be able to offer in the office. And so all of those types of things are extremely important to be able to discuss each year at your annual visit.
Have you found that during COVID those annual visits have gotten fewer? I mean, have people been canceling those or not coming in for those?
I mean, with this last uptick, a lot of it has just been rescheduling because, I mean, our incidence and the amount of cases that we've had in the Shreveport area has been so high. I felt like we're doing really good in the spring and summer until that happens. So I'm hoping people get healthy and come back in before December.
Yeah, we need to do that. Let's make this COVID thing go away, get your vaccine, yes. and get your annual visits. Okay, so where are you guys located? Tell everybody where you're located, phone number, website.
Yeah, so again, our office is Willis-Knight Pierremont OB-GYN Specialists. We're over at the Willis-Knight Pierremont facility. We're in Suite 600, and so 6th floor in the medical tower, and right next to the hospital. You can essentially drive right underneath the porte-cochere and be dropped off, and so you just take that elevator to the 6th floor.
Yep. And our phone number is 212-3890, and you can follow us on Instagram or Facebook at WK Pierremont OB-GYN Specialists or PierremontOBGYN.com.
Okay, so and talking about the nest one more time, we've got about 2 minutes left. Oh, excuse me, but that just hit my microphone. Goodness gracious. Live TV, guys. So do we know when the nest, that new birthing facility, will be ready?
So some of our first rooms, probably about 4 or 5 of them, will be ready by December.
Wow.
With the completion of the whole labor unit by mid-year next year. And so, but some of the amenities that they have, some of the spa services, obviously menu options are available now. So you can start kind of offering those. So it's definitely something that patients are going to be excited about. I know we're excited about it as providers to be able to offer that to our patients. So, it's going to be right around the corner.
Well, and I bet it's also going to be fun for you guys to deliver babies there.
Yes.
Absolutely.
Yes.
Yeah. What does it afford you guys that maybe you don't have in other situations?
I mean, I think for me, as a mom myself, I think the great thing is kind of being able to allow that bonding for my patients, and if they have any breastfeeding questions, if they have any, questions about what do I do when I go home, those kind of things, the nursery's right there too, which is going to be great. And so that's really going to help with all of that.
All right. Well, Doctors Huddleston and Hebert, I certainly appreciate you guys being with us. This has been fun. And thank you for watching Healthline 3. Until next time, stay safe and healthy and have a great afternoon.